Have you looked in the mirror lately and thought, something looks different? Maybe your face seems puffier, your hair is thinner, or you are bundling up in a sweater when everyone else is comfortable. You might chalk it up to getting older, but sometimes it is not age at all. It could be your thyroid. Now, hypothyroidism, or an underactive thyroid, is one of the most overlooked health issues, especially in people over 50. But the good news is, your body often gives you visible signs before things get serious. In this video, I'm going to walk you through 10 signs and symptoms that you can actually see on your face and body and explain what they mean. So stick with me until the end, because if you spot even one of these in the mirror, it might be time to get checked. Welcome back to the channel. And if it's your first time here, don't forget to hit that like button and subscribe to the channel. Now, before we get started, your thyroid is a small butterfly-shaped gland at the base of your neck. But don't let its size fool you. It might be small, but it's like the body's thermostat and gas pedal combined. It controls your metabolism, your energy, your body temperature, even how your skin and hair look. Now, when we say hypothyroidism, we simply mean that your thyroid is not producing enough hormones. And when that happens, everything slows down, including your metabolism. That's when you may start noticing changes, feeling more tired than usual, gaining weight more easily, or seeing differences in your skin, hair, and even your mood. And here's the tricky part. These changes happen so gradually, you might think they are just aging, but often they are not. Sign number 1, puffy face. If you notice your face looking more swollen, especially around the eyes and cheeks, that's one to pay attention to. With hypothyroidism, the slower metabolism causes your body to hold on to fluid. This swelling is called myxedema. It can give your face a rounder, puffier look. It is often most noticeable in the morning. But unlike normal morning puffiness that usually fades once you are up, moving, and maybe after sipping your cup of coffee, this can linger all day. Now, puffy eyes can happen for many other reasons, like allergies, lack of sleep. But when it's combined with other signs that we will cover in this video, it's worth paying attention. Number 2, dry or rough skin. Your skin can be one of the very first places to reveal that something's off with your thyroid. Here's why. When thyroid hormone levels drop, your body produces less oil and sweat. Without that natural protection, your skin's moisture barrier weakens, and suddenly it's more prone to dryness, flakiness, and sometimes itchiness. You may notice this on your elbows, shins, or hands. Even high-quality moisturizers may not help much because the issue is not on the surface. It's happening at a deeper metabolic level. So if your skin suddenly changes texture and starts feeling rough, almost like sandpaper, it could be a sign your thyroid is running low. Number 3, thinning hair or hair loss. Your hair needs 2 big things to grow strong and healthy: plenty of protein and good blood circulation. But when your thyroid is underactive, it can slow both of these down. That means your hair follicles do not get the nutrients they need, and the growth cycle starts to stall. Over time, your hair can become brittle, weaker, and more prone to falling out. And it is not just the hair on your head that's affected. You may notice thinning on the outer edges of your eyebrows, lighter or missing eyelashes, and even changes to arm hair. One telltale sign of hypothyroidism is when your eyebrows seem to shorten from the outside in. This is a classic sign of hypothyroidism. Number 4, swollen neck or goiter. Once again, your thyroid sits at the base of your neck. When it is struggling to make enough hormones, it can grow larger in an attempt to work harder. This swelling, often called a goiter, can sometimes be seen as a lump, or you may just notice a sense of tightness when you swallow or even when you wear a necklace. Other common causes include a lack of iodine in your diet or autoimmune conditions like Hashimoto's disease. Either way, if you notice this, it's worth checking out. Number 5, unexplained weight gain. This one can be especially frustrating for most people. You are eating the same as always, maybe even less, yet the pounds creep on. This is not about overeating. It's about your body running in low gear. When you have hypothyroidism, your metabolism slows down so much that your body starts storing more fat, even at your normal calorie intake. So here is the deal. If you have been gaining weight despite eating well and staying active, your thyroid could be the missing piece of the puzzle. Number 6, constantly feeling tired or sluggish. You may start to notice your eyelids feeling heavier, your movements slowing down, and your face carrying a kind of tired expression even if you have had a full night's sleep. With hypothyroidism, your cells are not producing energy like they should. And that does not just affect how you feel, it can change how you look. Your eyelids may droop a little, your expressions can become softer, and your movements can lose some of their usual spark. Often, friends and family notice this low-energy look before you do. It's not about laziness, it's simply your body showing the effects of reduced cellular energy. Number 7. Always feeling cold. Thyroid hormones regulate heat production. When they are low, your body struggles to generate warmth, especially in your hands, feet, and even your nose. If you find yourself bundling up in layers while everyone else is comfortable, or you avoid cold drinks because they make you shiver, your thyroid could be to blame. Number 8. Pale or yellowish skin. Poor circulation can leave your skin looking a little pale. When your thyroid is low, it can slow down blood flow to your skin, which is one reason your complexion may lose its usual color. In some cases, it can also affect how your body processes vitamin A, adding a very slight yellow tint to your skin. It's a subtle change, but you will often notice it more in natural daylight. One quick way to check: look at the inside of your lower eyelids. They should be a healthy pink. If they are looking pale, it is worth paying attention to. Number 9. Hoarseness or raspy voice. If your voice sounds deeper, rougher, or hoarser than it used to, the thyroid could be involved. Here's what happens. When the thyroid gland swells, it can press against your vocal cords. That pressure can make your voice sound lower, strained, or less clear. People who use their voice a lot, like singers, teachers, or public speakers, are often the first to pick up on these changes. And if your voice has shifted and it's stayed that way for several weeks, it's important not to brush it off. Number 10. Slow healing wounds or bruises. When your thyroid hormones are running low, your body's natural repair work slows down. That means your circulation is not as strong, and collagen, the protein that helps your skin heal, is not being produced as quickly. As a result, even minor injuries such as a nick from shaving or a scrape from the day can take much longer to heal. Bruises may linger for weeks, and those little cuts can seem stubborn. It's all because your body just isn't repairing itself at its usual pace. And there you have it. Remember, knowledge is power, and you have the power to make informed choices for your health. Thank you for watching.